This is a special report from News 3 WSIL.
Hello again, I'm Mark Kiesling. Tonight we continue our COVID conversations. We've been looking at COVID-19's impacts in our region and what that means for you. Tonight we take a deeper look at local vaccination efforts. For that, I turn it over to my co-anchor, Julie Williams.
Thank you, Mark. We're joined tonight by Miss Amanda Goins, the clinical educator with Ferrell Hospital. Ms. Goins, thank you so much for being here this evening with us. Now, you have kind of a range of duties. You're the clinical educator and a liaison with the National Guard and Emergency Management Services. So kind of walk me through what you do.
So as a clinical educator, I'm responsible for making sure our staff is knowledgeable in isolation procedures and taking care of those patients, that they know how to use their PPE properly so that they keeps them safe. As far as, I'm also the safety officer at our hospital, so I work hand in hand with our local emergency management agency. And they've been very good about, excuse me, keeping us stocked in supplies and also with staffing during this surge.
Wow, okay, so you're kind of it as far as things go. And, you know, you're involved in the vaccination rollout at Ferrell Hospital. How has that gone, and what challenges have you faced being, you know, in a rural area?
When the vaccine came out in December, our first priority was to get our frontline staff vaccinated. And then after that, we started having vaccine clinics for the public. Being a small critical access hospital, staffing was an issue, so I was able to coordinate with the Regional Health Coordinating Center in Region 5, and they were able to bring the National Guard in, and that's how we collaborated with them to have 3 large vaccine clinics that we were able to vaccinate over 900 people.
Wow, 900. So
Yeah.
I take it you saw a good turnout. Was
Yeah.
it, you know, kind of high demand? What
Very
was that
demand.
like?
Yeah, we had, our phone lines were jam-packed with people wanting appointments for the vaccine. And finally, our last clinic, we were able to do just a first come, first serve by the end of it.
Wow, and being so involved in getting folks vaccinated, what are your thoughts when you hear that some people are still, you know, hesitant to get their vaccine?
It's very frustrating because being on the front lines, we see these younger people coming in very sick and being put on ventilators. Our hospital's been overrun. It's been taking up to getting an ICU bed 4 hours away to get them to their higher level of care. So that's been a very big frustration for us.
Yeah, and you know, we've established that you're kind of the, you know, the go-to with a lot of what's going on right now. How has your role with Ferrell Hospital evolved over the past 18 months?
Well, in addition to doing the clinical education, the safety officer, the vaccination, I've worked hand in hand with our nurses. There are some days during very high volume days that our nursing leadership has worked hand in hand doing direct patient care, in addition to all their administrative duties.
Wow, and what does that, you know, strain put on your staff? What's that been like?
It's our staff is tired. We've seen more critical patients than we're used to keeping because we can't get them out. So it may that we may have to admit them to our facility for a couple days waiting on an ICU bed, and our nurses just aren't used to that high of acuity of patients. So they're tired.
Yeah, and being someone, you know, who's not in the hospital right now, I think for a lot of us, we hear, you know, our hospitals are overrun, nurses and staff are tired, and we can empathize with that, but what is the reality like being in the hospital or working with sick patients right now?
It's you try to do the best you can with what you have. Like I said, we're not equipped with ICUs in our small hospitals, so pulling every staff member we can, and many days it's all hands on deck just to get that one patient taken care of. But we're a family, we're a team, and we work together to take care of our community.
Yeah, I can't imagine all the work that goes on inside. And, you know, kind of coming back to the vaccine side of things, you know, Illinois says healthcare workers must be vaccinated. I guess, are you seeing any pushback from your staff? And I guess, what are your thoughts on that mandate?
We do still have a few staff that are hesitant for the vaccine. We try and educate them and give them all the information that we can, although we are staying compliant with weekly testing for our unvaccinated staff.
Okay. And any thoughts, you know, do you think vaccine mandates are appropriate?
I still think it's a personal choice, but we're there to follow what the mandates say. So we do stay current with the weekly testing
Okay. And
to keep our community safe.
right, right. And, you know, do you have any advice for people who might be on the fence tonight, even just watching our program, who say, I'm not sure if I want the vaccine? What would you say to them?
I'd say talk to who you trust, and for most of us, that's your primary care provider. Have a conversation with them. Most of them will give you all the information that they can that's out there, and I would say go to who you trust to get the most current information.
And we're seeing, you know, boosters starting to roll out. Any thoughts on that?
I think boosters are very appropriate, especially for those immunocompromised who may not get good immunity from the first two. And as we go on, we'll just have to watch the research and that's being done as to how long the immunity will stay.
Right. Well, Ms. Goins, I want to thank you so much for joining us tonight. We really appreciate you being here. We will have this entire conversation and more COVID-19 information on our website. That's WSILTV.com.